Infusing antibiotics into the udder of a dairy cow can help cure mastitis. Likewise, we can try to cure mastitis in dry cows as well as prevent new infections during the dry period if we infuse antibiotics right prior to the dry period. Infusion techniques are simple, but they follow one guiding principle. Infused teats should be clean and dry, and the only thing that should enter the teat should be a sterile cannula and the drug. In this demonstration, cows are being dry treated immediately after milking, but this can also apply to milking cow therapy as well. First, make sure the udder is clean of any loose debris and bedding. This probably was done as a preparation for milking. Second, wear clean, sterile gloves. Do not use the gloves that you wore during milking because they may have mastitis bacteria on them. You wouldn't want a doctor to wear dirty gloves when giving you an injection. We should do the same for our cows. Third, have the infusion tubes in a clean, dry, and easy to reach place. Never put tubes in pails of water before infusion. Fourth, take an alcohol-soaked cotton wipe or pad and thoroughly clean each teat end. Large wipes are easier to use and can clean better than small pads. Fifth, when cleaning teat ends, clean the far teats first and then clean the teats that are closest to you. This is so we don't reach across the near teat ends after cleaning and contaminate them with our arms. Sixth, if using small pads, use one pad for each teat. You may only need one large wipe for all 4 teats, but this will depend on the cleanliness of the teats. Seventh, carefully pull the cover off the cannula on the tube and do not let it touch anything. Ideally, a short-length cannula should be used when available. Eighth, gently insert the cannula into the teat and push the plunger. Ninth, if a second infusion is being given, for example an internal teat sealant at dry-off, then the teats should be cleaned again. Finally, never infuse anything into a teat other than a sterile, commercially prepared tube designed for intramammary infusion. Pulling drugs from vials designed for other purposes can cause problems, from contamination, mastitis, and unknown drug residue risks. This applies to drugs in bottles and natural home remedies. When this is all done, teats are often dipped with a germicide after infusion, but never dip teats in place of cleaning with alcohol before infusion. Teat infusions are simple, but doing them correctly requires careful technique and taking your time. If they're done hurried, or if they're done improperly, you can bring in new infections into the udder, and some of those can be severe and cause mastitis.